to the 22nd Central Texas African American Family Support Conference. Hi, my name is Minister Sonia Hosey, and I am your moderator for today's session. Shortly, we will enjoy your voice, your choice, exploring racial and health equity during COVID-19 epidemic. And while we're waiting for more people to come into the room, I hope, and I was getting ready to say pray. Yes, I'm going to say hope and pray that everyone will have an opportunity just to join us, but we're going to go ahead and continue just to go forward. While we're waiting, we're coming towards the end, and I believe everybody have had the questions throughout the day, but I want to ask this question. I really want to know how you're doing. And when I ask that question, I'm sincere about asking that question. We've had a lot of things going on today, a lot of presentations, people that were sharing. How are you doing? How are you doing? How are you doing? We just want to know. We just want to know how everybody is doing. Again, we've had so many different people come on and talk a little bit about all of the different things. And so, somebody said, girl, I'm tired. You can't say that. Girl, girl, I'm tired. I'm tired. Excited to get started. Somebody just said, hello, Chris. Yes, we are excited to get started. Excited to get started. Somebody said, hi, Chris. Tired and inspired. Tired and inspired. Yes, I believe that people have come through and, we've done an awesome job. And I do just want to say thank you to all of the planning committee and all that you have done. I'm thanking the integral care and all that you have done. And I don't want to belabor, kind of keep going on because I'm a crybaby. So I just want to say thank you. I do want to say before we get started, I want to give a big shout out to our sponsor, the Methodist Health Ministries. Thank you for making this conference as beautiful as it is. We cannot do anything without you. Would you like to go ahead and start your video? I believe you want to share a video real quickly.
I am Juan Moroni Omatad, and my organization, Methodist Healthcare Ministries, is a proud sponsor of the workshop session, Your Voice, Your Choice, Exploring Racial and Health Equity During the COVID-19 Pandemic. At Methodist Healthcare Ministries, we are committed to achieving health equity in our community and beyond. First and foremost, this means acknowledging that there are systemic inequities that hinder opportunities for everyone to thrive. Equitable access to things such as broadband internet, transportation, water, and many other determinants are critical as individuals and as a community. We are pleased to support your learning and engagement around this critical issue and encourage you to continue to share your knowledge and experience across our community. Dialogue, understanding, and engagement are the best way to drive action that will create opportunities for all of us to thrive.
Thank you again to our sponsor, Methodist Health Ministries. Thank you so much because we, again, cannot do this without you. This is a safe and supportive environment. We've all said that all day today. And I just want you to know that please help us to maintain a respectful and inclusive environment. We want to ensure that everybody is taking care of yourself. Please mute yourself at all times. We want to make sure that we are hearing the presenters clearly and loudly because we want to make sure that the presentation starts out well and ends out well. Use the chat function in Whova to interact with each other. attendees. And then for questions for the presenters, we also would like you to put the Q&A in the Q&A function in Hoover. If you feel overwhelmed, again, we have come to a place towards the end of the day with a whole lot of information. But if you feel overwhelmed, you need to talk to someone during the session, please call 512-472-4357. 512-472-4357. And then press 1 and then 1 again for immediate emotional support. Between sessions, you can visit the Comfort Suite, where we provide a safe haven. You'll find the Comfort Suite and Community under the main navigation in Hoover. We have a number of surveys. These surveys are very important because it helps us to plan for all of the upcoming conferences, and we really take your information and feedback to heart. This is what helps us plan a successful conference. If you're registered for CEUs, continuing education units, please check the chat links. The first link will sign you in for your CEUs. Please sign in at the very beginning of the session. After the workshop, there will be another link for CEUs evaluations. Please click on that link for a short evaluation, which also includes the CEU request. Once you have completed the evaluation, you'll be taken to a page to the link for your CEU certificate. The third link is the session evaluation. Please take this survey as well for a chance to win a $25 gift card. $25. I need $25. So a $25 gift card. I also need to let you know that we have some great conference merchandise, t-shirts, all kind of different things in the great conference merchandise. And you can check it out on our online store at ctaafsc.com/shop. So please join us in our favorite shop. Now introducing our last speakers for today. Please join me in welcoming our presenter. I'm going to say Jometra Hawkins and Jody McIntosh. Jometra Hawkins is often called a community translator. Through her past work, she has served as a bridge between communities and policymakers, uncovering the communication, the needs of residents in the underserved communities, and advocating for policies that will help lift our socio-economic status. She has overseen key health initiatives in Houston and the surrounding area, and currently serves as the co-chair of the African American Health Coalition. Then we have Jody McIntosh, is an experienced community engagement professional, adept at employing a public health lens to drive outcomes. Her interdisciplinary experience spans from research, implementation, and advocacy for harm reduction initiatives, peer-based recovery programs, and volunteer management in a food as medicine program for seriously ill. Most recently, she provided oversight for rehabilitation and community inclusion programs for individuals with intellectual and developmental disabilities. So now let's enjoy the presentation, and we'll be back soon after the live Q&A. Take it away. Take it away.
Good afternoon, everyone. Welcome to Your Voice, Your Choice, exploring racial and health equity during the COVID-19 pandemic. I am JodyAnn McIntosh, joined by
Jometra Hawkins.
So happy to be with you all this afternoon. So we are going to get right into it. Wow.
So today on our agenda, we'll talk through a few things, introducing us, the Fuse Fellows, as well as Fuse as a whole and our scope of work. We'll also talk a bit about the pandemic effects on people of color, privilege versus social determinants of health, the data analysis that we found, and ways we saw inequities. We'll also go through gap solutions and innovations. So gaps to fill, building sustainability, really working through relationships and the program pilots that we created because of the gaps that we saw. And then a call to action, of course, creating solutions. Harris County COVID Division Equity First plan that we were able to create from some of the gaps that we saw, and also Travis County's Equity Task Force that we saw as well.
So we'll go into our introductions, as Jo mentioned, talking a little bit about ourselves, and you can find more of our bio in the program booklet, who fuses, and the scope of our work.
So again, I'm Jometra Hawkins. I'm Executive Fellow for Fuse, and I'm working in Harris County Public Health in Houston, Texas.
And I am Jody McIntosh. I am the Executive Fellow in Travis County, and I'm working within the Travis County Health and Human Services.
So who is Fuse? Fuse is a national nonprofit organization that works on expanding social and economic opportunities, especially for communities that have been limited by a history of systematic and institutionalized racism. We work in cities and counties because we recognize that the most effective and enduring vision for system change emerges at the local level by working closely with communities. Fuse has done some great work embedding a lot of the community partners and community individuals that have been in the community a long time, and allow them to be put on projects with government entities to make sure that the community's voice is being heard. Fuse focuses on issues such as affordable housing, homelessness, workforce training, living wage jobs, pandemic response, and health equity, education reform, and digital access to public safety and justice reform, climate resilience, and green infrastructure, and so much more. Fuse has done a really good job integrating those community issues and making sure that we have fellows that can work on those specific things. Fuse has worked on over 250 projects in 37 cities and counties across 18 states, really working through and with a combined total of 19 million people actually served through these programs.
So the reason why Jo and I kind of started working together, well, one, Jo is amazing, but two, we had very similar scopes of work, especially originally when we got into our project starting this past August, and we were able to find some alignment between what we were doing, and found that our agencies were already communicating prior to us even getting here. And so we've kind of continued that work into what we're doing now. So starting in August 2021, the Executive Fellow will work to quickly build deep relationships with a wide range of critical stakeholders, including staff across county departments. So that includes public health, commissioners court, academic institutions, content experts, and community-based organizations conducting canvassing in underserved communities for COVID-19 awareness and assistance. The Executive fellow will have gotten up to speed to understand the dynamic COVID-19 operational landscape by reading documents, attending meetings, and engaging with all public health, healthcare, pharmacy, and government entities involved in the COVID-19 response. The executive fellow will develop a strong understanding of partnering agencies' COVID-19 response operations to include education and outreach, testing, epidemiology, and vaccine distribution and uptake. And I will say that for each of us, we found that there are some very core parts of our scope of work that has remained the same, but some of that has changed. And we'll talk a bit more about that throughout this presentation.
So pandemic effects on people of color. Let's go into a little bit of that.
So privilege and social determinants of health, otherwise known as SDOH, you might have heard of these terms before. We're just going to go through some definitions that we are going to be using for the purposes of this presentation. Privilege refers to certain social advantages, benefits, or degrees of prestige and respect that an individual has by virtue of belonging to certain social identity groups. Within American and other Western societies, these privileged social identities of people who have historically occupied positions of dominance over others include whites, males, heterosexuals, Christians, and the wealthy, among others. And then when we speak of social determinants of health, SDOH, those are the conditions in the environments where people live, work, play, and pray that affect a wide range of health, functioning, and quality of life outcomes and risks.
So with that, as you can see, there are a few components of social determinants of health that we talk through. So looking at economic stability, neighborhood and physical environment, education, food, community safety and social context, and of course, healthcare systems. Though the healthcare is essential to health, research shows that health outcomes are driven by an array of factors, including underlying genetics, health behaviors, social and environmental factors, and a financial distress are all its implications. While there is currently no consensus in research on the magnitude of the relative contributions of each of these factors to health, studies suggest that health behaviors and social and economic factors are primary drivers of health outcomes, and social and economic factors can shape individuals' health behaviors as well. There's extensive research that concludes that addressing social determinants of health is important for improving health outcomes and reducing health disparities. So prior to the pandemic, there were a variety of things and initiatives that were happening to address social determinants of health, both in health and non-health sectors. But as of the COVID pandemic, it basically exacerbated what was already existing issues, already existing health disparities for a broad range of populations, but specifically for people of color. So as we look through not only social determinants of health, we want to also give you a glimpse of privilege. So during the beginning of the COVID-19 pandemic, we found that privilege played a big role in who was getting vaccinated first, which neighborhoods were catered to first, how the unincorporated areas of the counties were left unattended to. And there were some really big issues where people were not getting the resources that they needed fast enough. So as we look at this wheel, there are many things that determine your privilege. Based on the chart, I myself am marginalized in so many areas that outweigh the other areas that I may be privileged. So if you look at the wheel, you can see at the very top is skin color. My skin color is a bit darker, so that puts me in the marginalized area. If you look around the wheel, of course, gender is one of those factors as well. So if you look at that, the cisgender man is in power, where a female or a cisgender woman is not so much in the power area. It begins to become that marginalized area. And then if you even look at the bottom to wealth, I'm not the richest in the world at all. That doesn't put me in a place of power. But as a middle class / poor person, it gives me that marginalized area. So you can see various other things that are on there. And I thought this was a really cool quote. White privilege means you actively benefited from the oppression of people of color. I thought that was a really powerful message to be able to put here, because a lot of times we don't look at those perspectives.
Absolutely. And I think even as we have done this work, we found that there are people who have recognized this, people in the white community, people who are in those positions of power, who have chosen to kind of use their position to amplify the voices of others, and have come together to I guess relinquish that power to communities of color and other oppressed groups. So it's encouraging to see that when it comes to the pandemic.
Right.
Okay, so these are mortality rates by ethnicity. And when we talk about mortality, we're talking about people who have died. So this graph here has been adjusted for age, and it shows that other racial groups are this many times more likely to have died of COVID-19 than white Americans. Jo, I don't know if you wanted to go into this a little bit more.
Sure. So you can really see that people of color were actually marginalized because of those privileges and social determinants of health. We discovered that many people of color were at a disadvantage or marginalized and died at a faster rate than most white people. So these documented nationwide actual mortality impacts from COVID-19 data for all race groups since it started at the beginning of the pandemic. As you can see, Indigenous people have the highest actual COVID-19 mortality rates. But if you look at African Americans or Blacks, you can see that they were 2 times more likely to die from COVID than any other racial group. So we really want to make sure that we are getting the message out, we're having these conversations, we are at the community grassroots level, making sure that people understand the importance of getting vaccinated, but not only that, just understanding the education that comes along with the COVID-19 pandemic.
Absolutely.
And this graph really shows you a little bit more in depth of those numbers and mortality rates by 100,000. So as you can see, 1 in every 390 Indigenous Americans have died from COVID-19. And then if you look at the African Americans, we're right underneath that. 1 in 555 Black people have died because of the COVID-19 pandemic per 100,000 people. So as you can see, those numbers are pretty shocking and astounding. As you can see, there were so many people that were affected by the pandemic, and it eventually passed away because of it. So I wanted to be able to show you guys really what's happening with the vaccine numbers as well, because Jody and I are working on vaccine distribution in those communities that need it the most. So vaccine distribution by race and ethnicity is plotted and compared across the 5 major metropolitan counties in Texas. The gray bar represents an ethnicity's percentage of a county's total population. if an ethnicity's proportion of the county's vaccinated population exceeds the county's general population percentage, the ethnicity is overrepresented in vaccine distribution. And if it is lower than the general population percentage, the ethnicity is underrepresented. The labels above each bar quantifies the degree of the over or underage of the representation. So as you can see, Asian residents are overrepresented in vaccination across all the counties. But if let's specifically look at African American Black people, those numbers are astounding. If you can really see, Blacks residents are underrepresented in all counties, which with the greatest underrepresentation in El Paso. But if you look at Harris County as well as Travis County, we've got a lot of work to do. We've got to make sure that people really understand the effects of the vaccine, why it's important to have it, and how we can really minimize this crisis in the COVID-19 pandemic.
And I think, you know, part of, and we'll go into this a little bit later, but part of having people understanding is finding those trusted resources and using those trusted resources. And that's a big part of the work that Jo and I are doing. So some of the ways we saw inequities, as we mentioned before, these are like gaps, and then we'll go into our solutions and innovations. We can kind of put them into 3 different buckets: a bucket of access, systems, and then hesitancy. So when we think about access, we saw gaps in locations, in language access, in transportation access, and then availability. We think about the systemic type of problems, hours of operations of vaccine clinics, availability again of these clinics, the plan for distribution, vaccination areas really being siloed, and then lack of equity. And then of course, the big kind of hot button issue that we hear about all the time is hesitancy, but it's really digging deeper into what that really means. And if it's truly hesitancy, there's mistrust. There are misconceptions about the vaccination and its benefits and or effects. Of course, community buy-in was a big one, and then also educating our community about the vaccination.
So because of those issues, Harris County has been working with a wide variety of community partners to provide testing and vaccines to the public through the pandemic. In August 2021, the Partner Incentive Pilot Program was introduced at Harris County. It was approved by the Commissioner's Court here, and we made sure that there were opportunities to be in the right places at the right time so people could get the resources that they really needed from Harris County Public Health. And we were able to recruit 10 partners providing vaccine events between August 20th and August 29th. So 9 days, guys. We did this in 9 days. And our initial goals were to make sure that we could provide vaccines in high priority areas. And as we talk about high priority areas, our partner organizations were chosen based on their location within Harris County Public Health. The priority zip codes, which in turn were determined by the CDC's Social Vulnerability Index, as well as some data that we pulled from historical instances of COVID-19 and then recent instances of COVID-19. Our goal too was to continue to build those trusted relationships within the community with those trusted partners. People are already going to great places within the community to get services. So we want to connect with those organizations that are already trusted in the community. We provided these organizations with activities, and we talked about their relationships within the community, highlighting the depth of their community relationships and the built-in trust they already have. As a part of the program, partners were requested to provide outreach and advertising of the vaccine events to attract their community members to get vaccinated. And then our goal number 3 really focused on direct incentives to those community partners. Feedback from those partners has highlighted that many organizations were really eager to support the public health initiative in the COVID crisis. They wanted to help us with testing. They wanted to help us with vaccinations, but most of those organizations lack the resources, i.e. funding, to be able to do these different programs and initiatives. So often funding is needed for, photocopies, flyers that they can distribute to the community, lunch for volunteers, canvassing teams, stipend for staff to open facilities to host those events. So we wanted to make sure that we weren't a burden on these organizations for doing this work, but we were actually helping them to continue the work. And then goal 4, talk more about direct incentives to the community. Of course, we know during the pandemic, economic effects of COVID-19 on the most vulnerable communities and the hesitancy we received from vaccines when they became available, people weren't feeling it. Like, they did not want to do this. And why would I take off work? Why would I go out of my way? I already don't have enough. COVID has taken a lot from me. So there weren't many opportunities for people of color or people that were in the most vulnerable areas of town. They couldn't do it. So with this, we gave a $100 incentive for those that had not been vaccinated to get their first vaccination dose. This gave them the opportunity to take off work, find transportation, maybe childcare, and so many other things. So those people could actually receive their vaccine in the places that they trust and they felt safe, and then also receive some sort of incentive to be able to continue on in their regular day. So as I stated, Commissioner's Court did approve this program in August 2021. The funding support for the community organizations to host at least 10 vaccine dispensing units in the community. And we were actually giving up to $5,000 per event based on the number of individuals that were vaccinated at each event, and also the $100 incentive. So we really focused on some key areas, the type of partners. So looking at faith-based organizations, as well as small local businesses, or local nonprofits that were in the area. And with those local nonprofits, we really wanted to make them the small, so less than 50 employees, because a lot of the larger nonprofit organizations had funding, had opportunities to do some of these things, but we wanted to focus in on those areas that were a bit smaller, more targeted to those particular primary zip codes that we wanted to make sure that we were hitting. And then we made sure that there were partner expectations, of course. So there was an application process, a vendor completion, like vendor forms that they had to finish. We asked them to host a COVID-19 vaccine event or a co-located event. So if they were already having something, maybe food giveaways or haircuts in the community, this was a way that they could add on this benefit of having COVID-19 vaccines available to the community while they were doing other events. And then attract at least 100 vaccine recipients. We were hoping that they would all be Harris County residents, but we didn't turn anyone away. If they needed to be vaccinated, we got them vaccinated. And then we gave them 2 to 3 weeks of event promotion to make sure that the community knew that we were coming. They had the opportunity to schedule that time frame, and they had the opportunity to see that there was an incentive involved as well. And then there were a host of internal collaborations, which is what I really love about this program. We got the entire Harris County Public Health up and moving for this program. So our resilience and equity team led this program within the organization. There were some really great opportunities with my colleagues, Kyle Maroney and Allison, which did some really good work to make sure that this program lasted, and we figured out every single detail to make sure that it could be a sustainable program as well. Working with our community outreach team and our communications team, we have a VDU scheduling team, VDU strike team, as well as our Harris County Public Health Connect, which is an organization that goes out, or a department that goes out and allows those residents to get the help and assistance in filling out applications for public benefits. Of course, we had our administration and finance team that participated in this program to make sure that our partners did get paid, and those individuals did receive their $100 cash card. And then our web and IT team made sure that our online application was perfect, our website was perfect, as well as our logistics team, the planning section, and our Harris County constables. Because we had so many gift cards on hand, we wanted to make sure that our team was safe. So we made sure that we had Harris County constables available as well. And then program funding, we had up to $100,000 for the pilot program for partners, and then up to about $500,000 in program funds for individual cash card incentives. Not only that, we made sure that we stuck with the primary zip code formula, which I mentioned earlier is the social vulnerability index, as well as the historical incidence of COVID-19, as well as the recent incidence of COVID-19 in those low vaccinated areas. And then also there's a storytelling piece. Data really tells the story. It matters. So those vaccination rates through MTRAC and Harris County Public Health actually created their own system to house the VaxTrack, which is our system to make sure that we're scheduling appointments for those that want to be vaccinated. So our program results really varied. We did a really good job and were really successful. As some of the partners from the incentive program had hosted previous vaccine events, Harris County Public Health was able to compare numbers from those non-incentive events with the vaccination numbers from the incentive events. And in the case of almost all of the events, the numbers rose considerably. All but one site doubled their numbers in attendance. All sites saw 50% or more vaccinated individuals that were Hispanic or African American. On average per site, partners saw almost a double number of African Americans that received vaccinations during the same time period. And on average, a quarter of the individuals were the younger population that we were looking for as well, that aged 10 to 19 years old, and under 40 demographics, which we were really concerned about, and we were able to do that. And then with the zip codes, we made sure that we got to those places that were that were not as vaccinated as other places. And then of course, we made sure that there were co-located events that went along with this. Like I mentioned, haircuts, food drives, those were more successful because there were other activities included. And the cash card incentive program, it functions simultaneously. Overall, the partner incentive program has been successful in increasing vaccine uptake in the priority zip codes. As the same partners from the incentive program had hosted previous events, Harris County Public Health were able to show those numbers and really show the considerably successful program. So some of those successes that we saw were, of course, we recruited 10 partners in the pilot program in those priority zip codes, priority areas. We made sure that we increased vaccine uptake in Hispanics and African Americans. Priority zip codes were reached. We were able to work from our top 25 to top 50 zip codes in Harris County, and a considerable amount of those zip codes were reached through that program. And then over 1,400 people were vaccinated in less than 2 weeks, in 9 days, guys. And then the program extension, we were able to be so successful in the pilot, we were able to extend the program to the Vaccine Partner Incentive Program with 50 additional partners through the end of December 2021. So some of those lessons learned, of course, marketing is very important. We wanted to make sure that we gave them enough time to actually market the event, the type of promotions that they actually gave. So if they were on Facebook, if they were doing canvassing, flyers in the community, there were so many different opportunities for marketing, and then those co-located events. We included more services as well in the extension program. So we wanted to make sure that we had those trusted partners on board that could be those vaccine site navigators. They would know ins and outs of the location, be able to answer questions to those that were coming to get vaccinated. And then also we included those health services from Harris County Public Health Connect, where they were able to help with applications for public benefits. And then our community partner relationships, of course, we were able to deepen those partnerships, activate those grassroots approaches, and really provide funding to those that were underfunded, a lot of times and not funded. A lot of these partners would use donations from the community or other partners to make these things happen. So this was a really big benefit for those organizations to be able to have that funding to host these events. And then of course, we wanted to make sure that we had pre-registration. When we started to do the incentive program, lines were wrapped around the building. So we wanted to make sure that we were getting more efficient. So we created pre-registration so those people could sign up online or in person and make sure that their vaccine was taken that day at their appointment time.
So as I mentioned before, Travis County had already been in discussion with Harris County about this amazing program, trying to glean information from them and get a better understanding of if this is something that would work in Travis County. And then when I arrived, it was decided like, yes, let's go forward with it. And so, of course, having my girl Jo in Houston, I was able to kind of connect with her, and all this information that she shared with you all, she shared with me, as well as Kyle and Allison there at Harris County Public Health. They were great in really being honest about the things that worked well for them and those lessons that they learned, so that when we tried to institute it, it would go a bit smoother for us. And so we coined our phrase familiar faces in familiar spaces, because that's what we're trying to do, right? And so for us, we had three main goals. The first goal was to increase vaccination in our target areas. So Houston is much larger city than Travis County, Austin area. So for us, we have 8 what we call priority zip codes, and these are the areas that have the lowest vaccination uptake. And they also happen to be in areas that are predominantly where people of color reside, and along what we call the Eastern Crescent of Travis County. Our second goal was to build trust and deepen relationships. And we wanted to do that in different kind of ways. So we wanted to deepen relationships between partners and community, as well as institutions, and the ways that all three of those kind of intersect was very important, because early on, as Jo mentioned, when the vaccine was first rolled out, there were some missteps, and there are various reasons for that. But as a result, it kind of broke the trust that community had with institutions, or that partners had with institutions, or that community had with partners. And so the idea is that creating a program like this can kind of go back to that basic and try to rebuild those relationships and build trust. And then our third goal was to meet the community in community to provide education. So, there's the phrase in public health, we want to meet people where they're at. That's exactly what we're doing. We believe that our community partners are the experts in knowing how to reach the people that they serve. And so it's about amplifying their voices to be able to do this work in the ways that make sense for them. And like the Harris County program, our pilot is also to have 10 partners. So we changed a few things. Like we said, it was inspired by Harris County, but tailored for Travis County. So the way that we did partner outreach was we sent emails to over 150 organizations, informing them of the program. And these were targeted organizations. So as Jo mentioned, there are some of the smaller organizations. I think, some of the larger ones were included also, but it was really about sending it to organizations that were in these target zip codes, or that served people in these target zip codes. We also had a very large reach with social media, through Facebook, Twitter, and especially through Nextdoor. We used 2 vaccinators. So we have, of course, our Travis County Mobile Strike Team, which is headed up by Constable George Morales and his folks. And then we also use an amazing community organization called Central Texas Allied Health Institute, otherwise known as CTHI. And they both are responsible for delivering the vaccines at these various locations. It all just depends on where it is, timing. That's more of like a scheduling thing. And also if they already have a relationship with the partner, things like that. But our staffing, this is kind of where we ran into a huge hurdle. And, I will say that Jo and the Harris County folks did warn us that this is very labor intensive, and that there needs to be folks that are dedicated to this. But we were kind of like slow stepping and saying, okay, let's just try it and kind of see how it works. But yes, we realized that there is a need to have staff kind of dedicated to this work. We are a very small team at the county. And so, Harris County has a lot of different, Jo talked about all the different partners, departments that they were working with. And we were working with a couple different departments. Of course, we were working with communications, with the web team, IT team, social media to get all of this out, purchasing, legal, all of those things. But as far as the actual program management, that is something that is labor intensive, and it's definitely a lesson learned for us on the best ways that we can move forward with the program, and of course make sure that we have sustainability. At the time of this recording, our program is just getting up and running, and I look forward to being able to report out on our results as Jo discussed the results from her program. I believe that there will be some similarities in the basics and foundations, but I am also prepared for us to have some differences, because as I mentioned, Travis County, Harris County, there are some differences with how we went about going with this program. And it's important for us to think about, while we're in the pilot phase, working out all of these different kinks. This is kind of different for the county, working in this way where it's kind of almost like a reimbursement for, we're telling folks, you do this and then we'll give you, the $50 per person, just like Harris County. It's a little bit different for not just not just like the government side, but also for community partners, because most community partners, when they apply for a grant, will get the money up front and then they're able to use it to do what they need to do. So we understand that that might have been a little bit shocking or different for people to kind of get adjusted to. And so even working on like how we message, how we bring that message out to folks is important in ensuring that people feel like they can trust us and trust that, you know, this is something that we want to do, and that we want to make sure that on both sides we're reaching our goal of getting more people vaccinated in these priority zip codes. So moving into our call to action, you know, the ways that we feel we can move forward in this work in the vaccination space and ultimately in the health equity space. Something that I am working on putting forth, and I would just like to make a huge disclaimer that this is not something that, you know, is in place. It is something that is a goal during my fellowship here. It is something that I am working towards, is to develop a county COVID-19 equity task force or an equity union. And the idea behind this is threefold, is that we can align resources, improve our efficiencies, and then ensure we have representation from key stakeholders, both intergovernmental and others. So when we talk about aligning resources, oh, another disclaimer, this idea is not, you know, didn't just come from me and my wonderful brain. No, this is an idea from, you know, doing 3 months and ongoing of listening tours, of talking to people who are doing this work on the ground, of talking to people in government and hearing their feedback and putting it together into something that I feel like is where we're headed, or where we could be headed. So going back, aligning resources kind of has 4 sections under it. We have data and IT, so accuracy and transparency in our data. Everyone is collecting some sort of data, and there is a lot of data out there, but it's not all available to each other. And I think it's important that, you know, all the different agencies that are doing this work are able to have access to the same types of data so that we can make sure that we are moving forward in the same ways that make sense for our organizations and that will maximize how we make an impact on COVID-19 vaccinations in our community. Our outreach and our education efforts, you know, there's been a big push for community health workers. I know both at Travis County and Harris County, there's been a lot of investment in using community health workers. It just goes back to show what we've been talking about, is that the community knows how to outreach to the community. And so investing in our communities in this way, where we're able to hire people who come from that community, who have an investment in that community, who believe in that community and know how to talk to them, can change the way that we do our work and can really make a lasting impact. Of course, we want to have diverse and inclusive staffing, both clinically and operationally. You know, that's one thing very early on that I noticed was most of the clinical staff did not look like the people that we were trying to reach. And we know that you know, it plays a role. It plays a role in how people perceive healthcare, but also how they perceive specifically how they perceive this vaccination, especially with all of the rhetoric around it. And so it's important that we continue to support organizations like Central Texas Allied Health Institute, who intentionally is recruiting and training clinical staff in our communities and our communities of color, and then going back out and serving those communities of color. Of course, our supply, so management and distribution. It could be more efficient if we, you know, had centralized locations where everyone can get things from and know how to order and when to order. We talk about improving efficiencies, our communication strategies, so language access and culturally appropriate messaging. You know, we talked about that language access earlier as a gap. There should not be any reason why a person who does not speak English isn't getting the information at the same time as a person who is speaking English. You know, that is a failure on our part, and There are ways that that can be remedied, I believe, by combining our efforts. As our media campaigns, coming together and doing larger media campaigns, reaching folks in the ways that they would like to be reached. So it's not always traditional, but coming together and doing that. And then consolidating some of our processes. There are a ton of meetings with the same players happening all the time. If we can kind of consolidate some of those meetings, streamline them, consolidate some of the processes. Some processes are the way they are because that's how they've been. But I think there also needs to be a recognition that sometimes these processes further contribute to inequity. And so when we're thinking about being equitable, we also always have to look, both systemic and then individual. What can we do to further make this an equitable process? And then lastly is that representation from the key stakeholders. So county stakeholders, here in Travis County, it's our Emergency Operations Center, which is a mixture of county and city. City stakeholders, the community, this is a big one. There are so many community organizations that are doing amazing work. There are community organizations that formed during the pandemic out of what they feel like there were gaps and wanting to fill those gaps. Why don't we formalize the role of these organizations that are doing the work, include them in the process as opposed to seeing them as auxiliary, but really they're a critical component to what we're doing, as we can see with our partner programs, including our funders, and then of course our health and education institutions. And the idea is that this type of equity task force or unit could be used right now for COVID-19, but also in the future for other health equity response, just having a framework of something that could be sustained beyond COVID-19 and that allows relationship building amongst all key stakeholders.
So I was very fortunate to have an opportunity to give recommendations to the Office of Emergency Preparedness and really think through what are opportunities to be more equitable. And from that, I made a recommendation of an equity first plan. COVID-19 inequities have greatly impacted the most vulnerable populations and those disadvantaged by race, ethnicity, age, occupation, residence, and socioeconomic statuses, as well as we mentioned before. Harris County Public Health, the Office of Public Health, Preparedness and Response, our senior policy planner, and the Equity and Resilience team came together to provide actionable recommendations to ensure equity is addressed first in the COVID-19 response and vaccine distribution. So with that being said, a lot of times when we're planning, we plan the way that we think that things can go, but we don't think about equity until it's possibly an afterthought. So this is an opportunity to include equity first in the strategic plan and making sure that equity is ingrained in the entire role of the Harris County Public Health COVID Division. So with that, we made equity commitments and developing equity maturity models, quarterly training for employees around equity, seeking to implement best practices in education that we found in other counties and other areas of the world, actually. And then taking our equity goals to align with our strategic plan. That's our commitment for the Harris County Public Health COVID Division. And then as we move on to the equity strategies, we wanted to improve investments. This is an opportunity to really look at those areas that need the funding, need the investments the most, the fastest, so you can make those decisions and make those recommendations to the County Commissioner's Court so those improvements can be made first in an equitable way. We wanted to make sure that we're continuing to deliver programs and develop programs that fit the community, and also having ongoing services within those communities as well. Our equity opportunities were to identify internal equity champions in the division. So making sure that we had someone that was focused on equity every single time we got ready to plan or put a strategic measure in place. We also wanted to create equity action plans for each department and each area of focus. We also wanted to create performance measures around equity as well that, again, align with the strategic plan. And then also those impact analysis, what we're doing, what we're putting in place. Is it really servicing the community? Is it really giving the impact that we were hoping for, those outcomes that we are hoping for? And then also the accountability of making sure that you put equity first. So putting those measures into employee performance measures and leadership performance measures as well. And then of course, we wanted to implement equity as a whole. So creating this equity first plan would give us the opportunity to do so. So that is our presentation, Your Voice, Your Choice. You can do it too. So we encourage you to collaborate with your internal partners as well as your external partners, having those conversations, really deeply rooting equity in the entire process, and making sure that there are better opportunities, better resources, better funding for those community partners to do the work and really connect and partner with you on a really trusted and respected relationship.
Thank you all so much. If you would like to get in contact with us, you can get in contact with Jo at jometra.hawkins@phctx.net. You can get in touch with me at JodyAnn.McIntosh@traviscountytx.gov. Looking forward to your questions.
Thank you.
Thank you so much, Jody and Jo. I mean, that was a whole lot of information. You've done a lot in your program. It was amazing where you started and where you ended. It appears that you all did a whole lot of work with limited limited people, but doing a whole lot of work. Whole lot of work. But we thank you so much. There is a question, and it's a two-part question. For each county, what would you do differently? And that's the first half of that question.
Go ahead, Jody.
Okay. So I'll say for us, one thing I would have done differently was the timing. When we decided to roll the program out, it was towards the end of last year. And I think there were competing priorities leading up to the holiday season where people weren't really kind of focused on trying to apply for something like, you know, we say we're reaching out to the community organizations. They already have things in motion that they're trying to do. And so applying for this particular program wasn't top of mind. Many of the people who did apply said, well, we can do something next year. And so I think for us, it would have been about changing how we timed it. You know, we wanted to say, well, we want to get vaccinations done before the holidays because we know people are going to get together, like let's roll it out, but that wasn't realistic for our partners.
Interesting.
Say in Harris County, there were several things we could have done differently. One of them would have been doing a lot of the administrative work at the beginning, rather than waiting until the program was kind of done. I really would have hoped that we would have done that. We had a little delay in making sure that our partners got paid because administrative work was done on the back end rather than the front end. I'd also say being able to have a bit more time to promote this program, gave the partners enough time to promote, but we literally got it passed in commissioner's court, and the next day they were asking, how many partners do we have? So we didn't really get the opportunity to really extend it out, even though by the end of the program we had more than 75 partners on our list, which was way more than the 50 that we initially wanted. but it was an opportunity for us to kind of grow our partnerships and grow our opportunities within the community. And we touched so many different people in so many different ways. So that's one of the ways I would say.
Awesome. The second part of this question, and yes, I see you, Deborah Murphy. The second part of this question is, what would you change to do it better or possibly done it better in hindsight? And you may have said a little bit about this, but can you just kind of go a little bit deeper in that? What would you change to do it better or possibly done it better in hindsight? Almost in a sense, around the same question.
Yeah, so to add on to that, it would be for us in Travis County, having staff that was dedicated to this program. It's really important if we're talking about building relationship with community organizations and understanding that we're trying to reach out to community organizations that might not have a grant writer, might not have even full-time staff, it might just be volunteer folks. There's going to be a lot of back and forth and support that's going to be needed. So having someone or people who would be dedicated to attending to those needs, in hindsight, we should have had that from the jump instead of trying to like go into it and then see if we need it. Like, no, we needed that from the jump.
Yeah, and I'd also say, kind of thinking back, and this is probably something I need to write down and really talk to the team about. But as I kind of think back, there were opportunities for us to do this program a bit differently and have one person at the helms as the leader that knows all things and is able to kind of convey the message to everyone. In this process, and I'm just going to be very transparent because I don't know how to be in anyway else. A lot of the people that we worked with and partners that we work with, those departments held those contacts really close. So a lot of those partners I didn't get to personally talk to, personally have an opportunity to kind of create the relationship based on the program that we were representing. A lot of times it was based on a previous relationship they've had with Harris County Public Health or a previous relationship with the staff person. So in hindsight, I would work more into being able to create the relationships for the program and then be able to pass them on to other opportunities to extend our partnership with those community organizations.
Yes, yes, it seems like you all were really challenged, but it seems as though that you really kind of got through it. Still a lot of work to do, but it sounds like you've kind of developed those partnerships that was really needed. Deborah Murphy.
Thank you. First of all, I'd like to say that this was absolutely fantastic work that you did.
Thank you.
My question is, as the COVID vaccine becomes something that we may have to get annually or biannually, we don't know right now how frequently we may have to get it. I was wondering if there's been sustainability of your efforts built in to accommodate that, whether it's by your organization or by the county or from whatever source. How will your good work and excellent work that you have been able to provide be sustained?
That is a great question. And it was one of the first questions that Jody and I had when we were designing these things. Jody has a different take on what I will say, but as we were continuing to build these partnerships, we made sure that we kept contact with them. So we actually have a scheduling team that reaches back out to these organizations. We no longer have the incentive available, so we don't have any more money to give. We do still have these partnerships intact and they are willing to continue to help us. So every week we still have 4 VDUs that are in rotation, the vaccine distribution units that actually go out and host these events as part of the Harris County Public Health. So we continue those relationships, and every time we actually need a certain area to be serviced, we'll call those partners that service those areas, and they're more than happy to participate in the program once again. So we're continuing to figure out how we can also expand those relationships even past the vaccine initiative. And we've now started doing testing distribution. So all of those partners that were a part of our vaccine partner incentive program, I sent out an email, picked up the phone and said, hey, we now have kits. Do you want them? Can you distribute them? And out of the 75 participants that we had in the program, we had about 43 of them that said, yes, we want the testing kits. We want to be able to continue to contribute to our community with the resources that you have. So that's kind of how we're making sure that we continue those partnerships, and they're not just transactional, but they become transformative relationships when we're actually doing something in those communities, keeping them abreast and making sure that they have all of the resources that they want and need, not just what we have.
Excellent. Thank you.
Yeah, Ms. Deborah, that's the $1 million question, is sustainability of our efforts, sustainability of this work. And as you mentioned, COVID will eventually become endemic. It will no longer be a pandemic. It will be something that we are living with. And so we have to start thinking about, while we're still in this government declared emergency, we have to also start thinking about, okay, well, what about long term? Like, what is all of this going to look like long term? And so my goal is to work with our partners and our stakeholders to include community organizations as part of the response efforts. That's really what I would love to get out of this at the end of my year, is that the community's voices are continue to be amplified, and all these community organizations that are out there on the ground every day doing this work are able to comfortably work with government organization, because we've built this relationship with them through this program, through other programs that government agency has. I know APH has a bunch of grants and programs that they're working on too. So how can we continue to build these partnerships with community organizations so that they know that they can work with government and don't have to feel like they're working against or in replace of government, but really we're truly doing this thing together. So when, God forbid, the next emergency comes, we already have the plan down pat. We already know how we're going to push forward, and it's not going to be where we're going to see these same gaps. I pray that we don't see these same gaps in how we respond.
There's another question. One is, can we contact participants today to have a Zoom call as to why people are not getting vaccines? That may have already been replied.
Oh, did they reply? Okay, that was Miss Maloney. Hi, Miss Maloney. So Miss Maloney is our community liaison at Travis County Health and Human Services, and she's been an amazing ally to have as I've been doing this work. I would love to do that, but of course it's up to the group. I would, part of this work is also understanding why. And Jo and I were just in a 3-day training with Fuse, and is talking about what's our why. And so really it's understanding for our communities, especially we're talking about the African American community, why aren't we? And then why are we? And there are so many different answers. And I think one of the missteps in the beginning of the rollout was an assumption about why people weren't taking the vaccine or that they would take the vaccine. And so if we're able to get that information directly from folks who are affected, we can continue to craft our programs around these things. And I know both Jo and I have worked to make adjustments within the vaccine partner program based on feedback that we're getting from our partners, where they say, okay, we might need this, or this works a little bit better. Can you do this? We're taking it all in, and we're using it to create better and more impactful programming.
Absolutely. And I will say, after our pilot, we actually did that. We sent a survey out to all of our partners and said, tell us what worked, tell us what didn't work, tell us why people aren't getting vaccinated, tell us what more could we do to make sure that we are still providing. And that's kind of how the test kits came into play. That's kind of how with our HP Harris County Public Health Connect came about, because they're not only going out to do services, but we also have our outreach team that's also providing care packages at different locations when they request information, when they're requesting mask or hand sanitizer. our outreach team is actually going out and servicing those areas too. So we've made sure that we've connected all of the dots, and anything that the community is saying is needed, or how they're feeling, or the reason why they're not, we're trying to address those reasons why within the public health scope.
I believe we have 2 minutes. I believe there's 2 questions, and each person can take these questions. You mentioned zip codes in the Crescent area. Can you give an idea as to where these areas are? You mentioned about the zip codes.
Yes, so that's 78721, 78724, 78753, 78752, 78742, 78617, 78741, and 78744. I'll post a message to answer that particular question with the zip codes.
Okay.
But those are zip codes for anybody who's been following the updates that are given every other week during Commissioner's Court. Those are the same zip codes that everybody, both APH and the county, have been trying to address.
Okay, thank you so much, Jody. There is one, and you all may have talked about this during your presentation, but what can be done in year 3 to close the gaps and to prepare for future crises?
We have to continue the work. We have to continue to learn from COVID-19, how it's been morphing. We also have to learn to listen to our community as well. A lot of times the answers that we need are right in front of us, but we just don't know that those resources are out there. We don't know that those things are out there. So consistently having conversations with the community, these community organizations, nonprofits, as well as those community leaders that are doing things, have that consistent relationship with them to continue the conversation, even past COVID, because a lot of the things that are affecting the African-American population with COVID is the comorbidities. So we go back to those: heart disease, stroke, cancer, all of those things that have kind of affected us adversely more than so many other racial groups. So I think that's an opportunity for us to close those gaps and listen more and be able to give more to the community as we need it.
Awesome. I just want everybody to know that this video is going to be available. And so there's a lot of information that was shared. But thank you again, Jo and Jody. We again, remember to complete your workshop surveys. Again, it helps us to know what we're going to be doing for next year. If you're seeking CEUs, remember that the forms will be in a survey and the links are in chat. I believe that there's one more thing. Somebody told me that there is a closing remark video. And again, we want to thank Methodist Health Ministries for their support.
I am Juan Moroni Omatad, and my organization, Methodist Healthcare Ministries, is a proud sponsor of the workshop session, Your Voice, Your Choice, Exploring Racial and Health Equity During the COVID-19 Pandemic. At Methodist Healthcare Ministries, we are committed to achieving health equity in our community and beyond. First and foremost, this means acknowledging that there are systemic inequities that hinder opportunities for everyone to thrive. Equitable access to things such as broadband internet, transportation, affordable housing and healthcare, clean water, and many other determinants are critical to our health and well-being as individuals and as a community. We are pleased to support your learning and engagement around this critical issue and encourage you to continue to share your knowledge and experience across our community. Dialogue, understanding, and engagement are the best way to drive action that will create opportunities for all of us to thrive.
Again, we want to say thank you. This again was the 2022 Central Texas African American Family Support Conference. We thank you so much. We thank all of our sponsors. We thank Integral Care, especially we thank all of our planning committee members. This has been an awesome time. And Only thing I can say is, thank everybody, and we hope to see you again soon. Continue the conversation. There's so much more we can do, but continue the conversation. God bless you. You be safe, and hope to see you next year. Bye-bye. Thank you so much. Bye-bye.